Rickettsia is a very important topic from the MCQ point of view. It is an gram-negative intracellular obligate parasite which is transmitted by the arthropod vector in the form of ticks, lice, fleas, mites. This picture is summarizing the sequelae of the rickettsial infection. This gram-negative infection is transmitted by the arthropod vector into the bloodstream, and it causes damage to the endothelial cells and in turn causes injury and thrombosis, vascular injury, infarctions, even DIC can occur. Now, if we classify the rickettsia, it is mainly two groups of the disorders. One is Rocky Mountain spotted fever, and other is the typhus, which includes the variety of the typhus infections, scrub typhus or the endemic typhus, murine typhus, epidemic typhus. We will discuss it later on. This slide shows a very simple way to remember all the vectors for the rickettsial diseases. The mnemonic is let, fen, try, MRPs. Let for louse, epidemic typhus. Fen for flea is causing endemic typhus. Tick is causing Rocky Mountain spotted fever along with the tick typhus. And the remaining is caused by the mites, which is your scrub typhus and your last one, pox, rickettsia pox. Okay, this is a very important slide which is summarizing all the clinical features of the different type of rickettsia infection. First, to start with the Rocky Mountain spotted fever, the rash is in the form of maculopapular or the petechial eruption, and there is a hemorrhagic lesions. So hemorrhage is a main characteristic of Rocky Mountain. This is not present in any other lesion, which can result in the gangrenes of the toes, fingers. An important thing to remember is for climbing the rocks, you always use your hand and feet. So palm soles will always be involved in the spotted fevers. As compared to the typhus, palm soles are spared. Maculopapular rash is also present in typhus, and there is also petechial eruption, but the palm soles are spared. This is the main difference. In the case of pox infection, by comparing it with the chicken pox, two similarities with the pox world, you can easily remember the vesicular eruption which results in the crusting. So vesicles and crusting are seen in the pox virus. Murine typhus is similar to your epidemic typhus but less severe form. Same maculopapular rash and petechiae but in the less milder form. And the scrub typhus, it is also mild and evanescent form, and in scrub typhus there is lymphadenopathy and crusting. Next slide is summarizing the scars that are present in different types of the lesions. If we say the scar or the crust, this is the feature of African tick bite fever, Mediterranean spotted fever, rickettsial pox, and scrub typhus. So this is a little clue to make your diagnosis. Whenever you find the crust, these four things should come in your mind about the rickettsia subtypes. Next, we are going to talk about actinomycetes, which comprises two bacteria, Actinomycosis and Nocardiosis. Let's talk about actinomycosis. Although it's an easy bacteria, no need to remember it by mnemonic, but for making it super easy, you can remember it as actinomycosis. The word actin represents a filament. So the main property of actinomycosis is the branching filaments, and A for anaerobic, or if you mixed it with A for aerobic, then you can remember ACT, air can't be tolerated. So it's an anaerobic bacteria, actinomycosis. And for making it super easy, you can remember it in a mnemonic, act in my crisis. So whenever you are in crisis, you cannot take care of your household, and there is opportunity for the thief to come in. So actinomycosis is basically a thief which has three characteristics. He is opportunistic, he is chronic occupation, like a thief is not doing it just for one time, and second, he is taking all the money in the form of granuloma. And the sign of S represents the sulfur granules, which is of yellow color. And when you do the staining of these granules or the colonies, these are represented as granular colonies which form ready, delicate filaments which bear the club-shaped processes in the form of sun ray filaments. So by this shape, you can remember the characteristic of your granules. And the culture that is used is blood culture, in which the organism is shown as the spider ray fungus. Now for the treatment, you can remember this thief who was stealing all the stuff in the form of granuloma. He has to put in a long-term high-dose saline. Saline is for jail. So saline denotes for penicillin. So treatment of actinomycosis is high-dose penicillin, and alternative to penicillin is any drug that acts on the staph. These are same drugs that acting on actinomycosis, like erythromycin, tetracycline, chloramphenicol, imipenem. So these are the options you can use as an alternative who are in those patients who are allergic to penicillin. Now comes Nocardia. Talking about Nocardia, it has the similar properties as actinomycosis. It's forming branching filaments that is gram-positive, but the difference is it's an aerobic bacteria that loves oxygen. The other characteristics are same. It's non-motile, non-spore forming. One very typical characteristic of Nocardia is the partial acid-fast property that is seen as the red filaments in the Zn staining. And to remember the organism, you can remember is by A, B, C, M. A for asteroids, and B for Braziliensis, C for KV, and N for medulla. That is forming actinomycosis medulla foot. Soil is the natural inhabitant of this nocardiosis, so it's always an exogenous infection. And when it becomes airborne in the immunocompromised patient, it forms a TB-like illness in the form of localized diffuse infection. And other infections, portal of entry is trauma to the feet, which can cause localized cutaneous infection. Depending upon the form of infection, either sputum or the pus is cultured in the form of Zn staining, which is showing partial acid fast. Culture for brain heart infusion, anger, and seborrheic agar. You find the dry, granular, wrinkled colonies of the nocardiosis. And the treatment for nocardiosis is drug of choice is cotrimoxazole, which is a combination of sulfonamide and trimethoprim. So for nocardiosis, you have the option of sulfonamide and trimethoprim. Sulfonamides alone, or other options are ampicillin, minocycline, amikacin, and cefotaxime. Another easy way to remember the treatment of actinomycetes is SNAP. SNAP, S for sulfonamides, N for nocardia, A for actinomycetes, P for penicillin. So SNAP is just a quick review for the treatment options for actinomycosis. Another important disease is Kawasaki disease, which features as a young child with a history of fever and the lymphadenopathy, strawberry tango examination, and the rash healed with desquamation in 1 to 2 weeks. And there is a complication of the coronary artery aneurysms and the cardiac diseases.